Hi, my name is Dr. Felucio, and I'm a licensed psychologist. And today I'm going to be talking to you about what to do when you feel like therapy is not working or you're not getting better. So, the first reason why this might be occurring is because there isn't really a treatment plan that has been formulated or that's been communicated to you as a client. Now, what a treatment plan is simply is what you're going to be doing in therapy and how that actually is going to be addressing your symptoms. And so your therapist might actually have a treatment plan, but for some reason that hasn't really been communicated to you. And so it's really important that you understand where exactly you are in the therapy process. You might still be in the beginning stages where your therapist is trying to get more information about what's going on with your symptoms, and so this is why it's very important that you communicate your concerns with your therapist and make sure that there actually is a treatment plan in place. And you can ask to, get more details about the treatment plan. What are the main problems that you're working on and how are they going to be addressed within the therapeutic environment? And so the second, and probably one of the more obvious reasons that you might not be seeing the progress you want in therapy is because there is a lack of consistent attendance. And that could be for a couple of reasons. The first might be because of your therapist's availability. And so if that is going on, one thing that you might want to do is if you know that your therapist has a really tricky schedule, get a time and commit to it and book your sessions out for a few or several weeks in advance, depending on what you can do. And that way, you know that you are on the books and that you can attend regularly. The other reason for you not seeing progress is because you might have issues with your own schedule and you can't attend consistently. And again, that is why I recommend having a time that works really well for you. When you find yourself canceling appointments and not looking forward to going to therapy, it may be as simple as a scheduling issue. If you're scheduling sessions late at night when you're really tired and coming back from work, that might not be a good time for you. So try and find a time that works best for you, where you're free of interruptions and where you can commit for several weeks at a time. So timing is also really important. And again, this can be brought up and should be brought up with the therapist. The two of you can be in agreement about what time works best for your schedules. The third issue that I see when clients bring up that, or clients will talk about not doing well or not getting better in therapy is because nothing's being done in between sessions. And that could be, that's an important reason to look more into. So therapists usually will give clients some sort of homework. And when I talk about homework, it's not sitting down always with a paper and pencil. It really means something that you are doing in between each session so that the skills you are working on are cemented, they're staying fresh in your mind, and you have opportunities to work on them. If you've ever taken a musical instrument or learned to play a musical instrument or participated in a sport, you understand that what really happens, where the real magic happens, is between sessions, between practice, where you are working independently on those skills. And it's the same with therapy. If you're going to make progress, you need to be able to work on your therapy skills that you learn in the therapy session in real life environments. And so if you're not seeing progress, it might be because you're not getting homework or you may not be getting the right type of homework. So that's an opportunity to communicate with your therapist about this and talk about, what you can do. You can say, I'd really like to have some more or some different opportunities to work on these skills outside of session, and collaborate as to how that will be the most useful to you. And then another reason why you may not be seeing progress is because of the dynamic between you and your therapist. And so sometimes I'll hear about clients will really like spending time with their therapist and they feel understood, but they don't see much change. So, I love going every session, but I'm just not really feeling better over the long run. Maybe they've been in therapy for several weeks, several months, and they're just not seeing any outcome that they would look at as reaching or improving on their goals. And so when this happens, the therapist may be doing more listening and not enough challenging. And when this happens, this is an opportunity for you to speak up about it or let them know that, I really appreciate you listening, but I also need more challenge. And so in some of these cases, if the therapist might be providing a lot of reassurance. And this again happens with anxiety, with clients who have a lot of anxiety. And I talked about this in one of my previous videos about skills to look for in a good therapist. And when you have a therapist that it's challenging you well to overcome your anxiety, one of the things that you'll see is that they are providing validation for your feelings, but they're not providing too much reassurance. And so when you are in a situation where you have a therapist that's just passively listening, they may be listening to you vent for 50 minutes, and then by the time you know it, the session's over, and you haven't addressed really what you're going to do about the problem, and it's a repeated pattern, then there's the time where we need to address something. And a therapist's job is to listen. That's part of what we do. We provide validation. We listen to really challenging situations, but there need to be times where we gently but firmly challenge you to grow and hold yourself accountable to the things that you came into session to work on. And so those are the 4 reasons why therapy may not be working. I'm going to recap them again. It's really kind of the lack of communication around a treatment plan, lack of consistent attendance, lack of work being done in between sessions, especially work that is connected to an observable treatment outcome. And then the last is just really having the therapist doing a lot of listening, but not a lot of challenging you regarding your goals that you came into therapy for. And my feedback about that is just bring that up, try and find ways that you can communicate about that. And if not, it may not be a good fit. And then you may need to move on to find a good fit between you and a therapist is going to help you reach the goals that you came into treatment for. So if you found this information helpful, please hit the like button and subscribe, and then also put in the comments below what sort of videos or what types of questions, comments, topics, etc., that you would like to hear more from me about. May you have a peaceful and joyful day. Bye-bye.